Hello there, this is Jack with Angel Home Solution. Happy Friday, and today Friday Health and Fitness. I want to talk about how can one prevent heart disease, what is heart disease, and what are the seven area you can control and prevent heart disease. First of all, this full disclaimer, I am not a doctor, I'm not a physician. This is my own research and I just want to share this for your reference. So you can aware of this and therefore apply preventative action for your own benefit. First of all, what is heart disease? Heart disease is a term used to describe several heart issues such as heart attack, stroke, and heart failure. The most common cause of the heart disease is blockages, you know, of the artery, artery, right? It is a blood vessel that pump blood to and from your heart. Heart disease, can cause your whole body health, right? A healthy heart can keep your body healthy as well. So in return, understand your risk factor is important. It related to age, sex, um, family history, and race. Sex is both men and women can be affected by heart disease. Men develop it much sooner, earlier in life than women does. However, more women, than men die of heart disease. Unfortunately, you can check out more information about that at heart.org. Um, Topic related to American Heart Association, American Stroke Association, Women and Vascular Disease, 2013. So the seven area that you can control and prevent heart disease are tobacco use. Unfortunately, a lot of people consume tobacco, cigarette. My dad used to be one, but after he was diagnosed with tobacco, the tuberculosis, the TD, or TB, he was, volunteer by himself to quit after knowing, all the downside. So it is hard, but it is totally possible. The second one is high blood pressure. Damage and may cause block artery. So talk to your doctor if you have high blood pressure. Try to limit your salt consumption. Obviously the next one is high cholesterol, result in blockage of artery. One of the major cause of heart disease, right? So in the next video, I will talk about high density cholesterol, the HDL. High density and the low density one, the low density cholesterol, which is bad. High density is the good one. I'll try to dig some more research on how can one improve their high density cholesterol. So the next one is blood sugar. High blood glucose level increase the threat of diabetes, which share some of the same risk factor of heart disease too. Weight, obviously, it is very important. People who are overweight are more likely to develop heart disease. Just because in general, fat in the body, it's also appear in the artery and stuff, therefore causing blockages, right? And therefore, with blood pressure, with high blood pressure combined, it could destroy the vessel. Just the side effect of that. Nutrition, eating a heart healthy diet can reduce your risk by influencing your weight, blood pressure, glucose, and cholesterol. Physical activity is very important. Inactive Inactivity raise your risk, right? Raise your risk from not working out, the body most important muscle, and increase the likelihood of weight gain, both of which can have negative effects on your heart and your overall health. So as you can see, all of these really mingle together. So to lower blood pressure, to lower the weight, to lower cholesterol, it need nutrition, it need physical activity, and all the good stuff. So you really have to take into account on all to see the advantage, right? It takes persistent, like whatever we do in life, persistent and patient. Um, so take control of your health would be a good investment, right? That's what I try to do. Try to shift my focus on health. Try to do exercise every day, alternating my exercise. Like on the other video, I was talking about cardio and muscle has to go hand in hand. Also, drink a lot of water, and how much consumption you need. Please refer to my past video, last week video actually. So, what are the next step? Use the heart disease risk calculator to assess your risk. Um, and then I'll try to do more lesson learn on this important topic. How to um, do the important of health screening. Um, so obviously, talk to your doctor if you feel any chest pain and whatnot, anything that you are worried about. Talk to your physician always. Don't skip that. I learned that from experience. Actually, I went to my blood test and physical checkup a couple weeks ago. After 5 years not seeing a doctor at all, find out I have high cholesterol. Of course, my high density cholesterol is super low, um, and other stuff that surprisingly. And one other thing that also happened is my potassium level is through the roof, more than, I think, 50% more than the recommended um, range. But fortunately, it was a fault test result. So doctor asked me to go back and redo the test, and it come down normal. So skipping the test is really risky. What happened if that false negative happen to be the actual, happen to be real. If I don't know that, I could risk my life because of that. Knowing these things ahead of time allow you to take corrective action. Therefore, having a longer life. So anyway, I hope this is great content. Again, this is provided by Angel Home Solution. Please stay tuned, subscribe, and share so that we can share all of these information to you, to someone that you know and could take advantage of this, right? And as always, if you see any missing piece, anything that we can improve, or any other comment you want to add onto this lesson learned and what I found, feel free to comment on, and I'll be happy to spread out the word. And if you have other suggestion on topic to talk about, please do so. I'll try my best to do my research and provide that topic to you. Thank you so much, and have a great weekend. Bye.